Dealing with prostate cancer is a grinding, difficult course both emotionally and physically. Once all the treatments are done, getting back to a normal life can be equally as challenging. For many prostate cancer survivors, sexual dysfunction is a common problem caused by many different reasons. Here we will discuss the sexual issues that arise after prostate cancer. The most common treatment-related side effect for men with prostate cancer is erectile dysfunction. This generally happens fairly quickly after surgical treatment and within 1 to 3 years after radiation therapy. Repeat prostate biopsies and active surveillance after treatment can also be associated with erectile dysfunction. Studies have shown that ED was present in 37% of all patients after prostate cancer treatment. Despite this, a significant portion of men who have had prostate cancer do not seek therapy, even though there are quite a few options. If you are someone that has survived prostate cancer and are now experiencing ED, our experts are here to tell you that 1, you are not alone, and 2, there are a lot of options available for you. Our videos on treatment options don't specifically mention prostate cancer, but almost all the options are available for you to use. Another major side effect that can happen after prostate cancer treatment involves changes in orgasms. The most common problem is lack of ejaculation at the point of orgasm, known as having dry orgasms. If you have had surgery as treatment, you are more likely to have dry orgasms immediately. However, if you had radiation therapy, it may be several months to years until you start experiencing dry orgasms. A related problem is losing urinary control during ejaculation and having urine exit instead of semen during orgasm. This usually occurs for those who have had radical prostatectomy, usually in the first year following a treatment. Adjusting to these changes can be very challenging, both for you and your partner. The unfortunate truth is that there aren't many therapies yet that can be used to fix these side effects directly. However, it has been shown that certain self-management strategies may help. For example, trying to empty your bladder before sexual activity has shown to be beneficial. Additionally, due to all the structural integrity damage that can be done during treatment, the perception of penile shortening has been documented in some studies. There aren't many studies to prove that penile shortening actually happens, but the self-perceived shortening following radical prostatectomy has been shown. Most importantly, we want to find ways to make sure that your quality of life is as high as possible, and this includes your sex life. First and foremost, if you have a long-term sexual partner, it's important to go on this journey together. Open up communication about what your changes are and how you feel about them. Studies have shown that there is a significant higher quality of sex life in couples that are communicative and work together towards reclaiming their love life. Finally, many survivors inquire about testosterone replacement therapy. Currently, the use of testosterone therapy is controversial after prostate therapy. The reason for this is because the prostate cancer cells have receptors for testosterone, and it could potentially cause growth of those cancer cells. However, there have been studies done to see if there's an increased risk for relapse of cancer for those that take testosterone after treatment. So far, it hasn't shown to increase risk. As of right now, our experts recommend that if you are a survivor of prostate cancer, have a discussion with your physician about the use of testosterone therapy if you are experiencing signs and symptoms of testosterone depletion. If your treatment indicates a cure from cancer and your PSA is being routinely checked, you may be a candidate. However, if you are someone receiving androgen deprivation therapy for metastatic or high-risk prostate cancer, testosterone is contraindicated.